Hello everybody, now I have the honor of introducing to you Dr. Sachin Gupta, rank 44, November 2018 AIIMS. Awesome rank, awesome performance. Sachin, how are you feeling today?
Thank you, sir. I am feeling very happy, sir. I am feeling very blessed. It was not possible without help of my parents, teachers and my family, friends. It is not my only achievement. It is due to all of us combined effort.
It's always like this, I think.
Yes, it's always there. Nobody can do alone in everything.
Yes. And
वो हिंदी में बोलते हैं अकेला चना बाहर नहीं फोड़ सकता.
सच बात है, सच बात है. So, you know, Sachin, it has been such a pleasure to know you for so long. Like you were with us for I think a 3-year course.
Yes, a 3-year course.
You did the foundation course, then you did the first, second prof with us, then test and discussion.
Then I attended DBT.
Yes, sir. How was the experience in DAMS? मतलब जब आए शुरू में उस समय पता भी नहीं था पीजेंट शुरू कर रहे थे, कैसा लगा?
सर वो एमबीबीएस में सिलेक्शन हुआ, उसके बाद ऐसे चिल हो गया कि कुछ करना ही नहीं है लाइफ में, अब तो हम ही सब कुछ हैं. हो गया एम्स में सिलेक्शन, फिर चिल मारने लगे, फिर उसके बाद डैम्स ज्वाइन किया, फिर लगा हाँ ऐसे पढ़ना होता है. फिर धीरे धीरे फ्लो आया, मतलब आइडिया हो गया हाँ बुक्स में कैसे पढ़ना है, क्या पढ़ना है. नहीं तो आप ऐसे ब्लाइंडली बुक पढ़ोगे तब पढ़ते ही रह जाते हैं, आइडिया नहीं लगता इंपॉर्टेंट मार्क्स क्या है. तो टीचर्स के नोट्स एकदम फिल्टर्ड होते हैं, आपको क्या पढ़ना है, फोकस कैसे करना है, थोड़ा आइडिया लग जाता है उससे. I was not very serious during foundation days, but it was mostly about notes. I have notes, I will study them, and I studied only those.
So, your focus was your focus was attending the classes, making notes.
My focus was making notes because I know I have to read them in internship. I cannot read books in internship. So my main focus was what we'll do last year, and in last year my focus was what we'll do in last month. Yeah. Things should be concise. You cannot recall you read 3 months ago.
So were you happy with the quality of notes that the teachers had?
Yes, sir. Notes are very good quality. You cannot give everything to anyone. There are some questions out of notes, but you cannot run about that. Every subject there are 2-3 questions. You are reading books on books. You cannot do that. Teachers know what is important. They give you that.
So, your idea was to follow what the teachers are saying, yes, and make notes, yes, so that you can utilize them in the end in the revision.
In the revision.
So that is why in the revision, when you came in the internship, you selected test and discussion course.
Yes, test and discussion.
And were you happy with the test and discussion?
Yes, sir. Those were good. You are solving questions. You are attending discussion. Your idea, what are you doing wrong? You have left something during old days. You are seeing those topics. Yes, these are important. That's very important.
Did you learn from your mistakes after you have finished a T&D test? Did you go home and see what I have done wrong?
Yes,
or
sir.
In the class itself you were doing that analysis?
Sir, mostly sometime we are not getting time. Then I was just attending class. Let's attend a class. We will read these when I have time. When you have some light posting time. Sometime your postings are too hard. You cannot study everything. Basically you are giving test to your idea. What are you doing wrong? You are practice more of a practice. So continuous process, you are saying you are doing wrong, you are seeing solution, you are attending the class, they are telling this is wrong. Then you are going again reading that, yeah, this was my wrong, I think about that way, this was my approach. So that's very important, you are doing questions in TND.
Did you enjoy the AIIMS mock that we conducted?
Yes, sir, AIIMS mock was very good quality. It gives you, yes, you have to 3 hours, you have to solve 2 questions online platform. You have idea how much time it will take.
Did you enjoy the mop-up sessions, especially for AIIMS?
Yes, sir, mop-up are very important,
especially
emergency medicine. I stopped reading systemic medicine. I thought AIIMS mostly focus on emergency medicine. So I read those, I saw those mop-up, and for anatomy, histology mop-up, I was there twice. It was image-based, everything covered so systematically.
Were you happy with the AIIMS focus that we had on those special extra sessions?
Yes, sir. Those are especially for AIIMS. That's why I am happy. They are doing this for only AIIMS. Most other people focus on NEET only. Yeah. So, sir, that's good thing. Yes, there is something for AIIMS.
Were you happy with the previous papers that we had loaded for AIIMS? Because yes, in AIIMS, that previous papers play a significant role.
Yes, sir. Most of the questions are very, very much repeat in AIIMS. You have to read those from authentic source. You are reading some books. You don't know they are right or wrong. There is AIIMS good platform. You can read those. Understand those, yes, these are right, these are gold standard, and they are controversial questions, just go for any one solution, that's on you.
And plus now this year onwards, now we have a special video solution for AIIMS, PGI, JIPMER, recent papers.
Yes, sir, I was seeing the recent paper videos I saw.
Yeah.
And sometimes you don't want to study, so let's see something, let's watch something, relax.
And I believe in a philosophy, when a teacher is teaching to you, those words will stay longer with you than reading from a
books. Yes, sir.
And especially if it is from a random book where you don't have a full faith on it, yes, you can't retain. So yes, sir, that also works.
You are not sure it's that right or not I am reading. That's point. You have studied from that teacher. You are again seeing that teacher saying same thing, saying yeah you can see this is not say this is where you can approach questions. That's very important.
And I think, you know, the video solution also help us to tell students, like as a teacher now what I found is that when I see a question which is like controversial in like 2 years back in AIIMS, in a video solution I'm able to tell the student that okay, this was asked once, I don't think they will ask you this again. Yes. This is the best answer, but this is the problem in the question. Sir. But in the written format, I think sometimes the students do not understand, and they put so much energy on that controversial thing. Sir. And if you notice, every time they have only repeated the conceptual parts, they have not repeated controversies too much. They have only asked once usually. So
once or twice. But basically, if you keep focused on controversy, as this book has given this book has given this, what you can do, you have to mark one option at last.
And then you might actually spoil your career by just looking at controversy. Because in the real exam, you have to get basic questions.
And you are studied very well that controversy, you will think this book में ये दिया था, इस book में ये दिया था, अब मैं कौन सा मारूं, वहाँ बैठ के सोच रहे हैं, टाइम वेस्ट कर रहे हैं. तो बहुत अच्छे से पढ़ने का भी ये नुकसान है controversy को.
And plus, so controversy, why some question is controversial is because sometimes the language of the question or of the recall that the students have done is ambiguous.
Yes.
So on that ambiguity, you know, if you think too hard, you can think in A direction and B direction both.
Yes,
so you have to go with your teacher that you have a faith on, and then you know, close it. Otherwise, what will happen? You will endlessly keep debating on controversial questions.
Yes, that's very important. Have faith on whatever you are studying. Faith on your notes. Faith on your teachers.
Were you happy with the, you know, the teaching that we did? You know, we focused significantly on the visuals and how to approach that. Were you happy with that?
Yes, sir. That's very important. And e-books, DAMS e-books, that was a very good thing. Sometimes you don't want to study, you just want to see something. You are just sliding, saying, yeah, this is this, this is this. That's a very good thing.
Yeah. Now this year I'm launching an ebook which would have a searchable option as well. So you can, you know, search through, like this year we are creating something like if you search tuberculosis, you will get tuberculosis in all subjects.
So that's very awesome thing.
We are creating it now. So maybe that is the next big thing that we are launching. So at DAMS, you know, we are always innovating. We are trying to find new ways to, you know, improve the delivery to help students to, you know, reach to their level best.
Yes, sir.
Now, I also want to know this, and I've asked all top 50 rankers this so that, you know, everybody can get an idea on the attempt ratio. How many questions did you attempt in this exam?
I attempt all the questions. Basically, everybody knows the AIIMS is highly competitive exam. There are very less seats. And question is highly doubtable. You know, the 2 options are wrong, but 2 options you know right or wrong. So you have to take risk. In general, if you go only for you are sure only around 110 questions, and you are not getting anything out of those. You have to take risk, and that's simple. You are doing 3 questions, doing 2 wrong, 1 right. That's still equal to not attempting to. It's better to go aggressive. Everybody does that.
And how was your approach? Like you went 120 questions and then you did the others, or what was your approach?
I went through. I thought that I will take around 2.5 hours for first reading. So I have to mark only 20-30 questions for review. Because too much review, you don't have time to think, and you are not getting anything new on that time. You know already.
Yeah, but I personally believe that, you know, if you don't recall it at the first go, in those 3 hours, it is highly unlikely that it will come back to you.
There is stress, then so much questions to think.
So I personally recommend that if you leave too many questions for review, you are creating problem for yourself in an exam like AIIMS. And add to it, if you don't save them, they will not count your answers.
They won't count anything.
So, you know, you have to keep this in mind. Although in this AIIMS exam, time crunch was not felt by most of the candidates.
Yes, sir. Time was okay, but generally seniors say
in May it is actually always more lengthy. Last May exam was more lengthy. So November.
Yes, but you don't know doing the paper how will be the paper. So we have to go account that time frame. We have to do it in this question at the time.
Yes. Any particular advice you want to give to future aspirants, especially anybody who's appearing for May AIIMS? Any topics that you want them to stress on?
Topics, basically do AIIMS previous year questions. They repeat topics.
Yes, definitely.
So do AIIMS previous year questions, anatomy, basically neuro and art, medicine में emergency medicine, surgery में general surgery. They ask superficially, and the must is first and second chapters subjects. You have to read those and exam details.
And the proportion of the basic sciences questions is higher in AIIMS as compared to NEET. Yes, so, however, you know, all said and done, still in NEET, you have 125 questions on basic sciences, 175 on clinical. In AIIMS, it is almost 100, almost 50.
And sir, you can think something about medicine, surgery, I have seen this, I can do this. You have not studied in biochem, you cannot do that.
Yeah.
This is cycle, this is enzyme, that's it. You cannot do anything in that.
So anybody who's preparing for next times, I recommend that towards the end, when you are revising, shift to basic sciences and prioritize them.
Basically, last week focus on forensic, biochem, volatile subjects.
Yes, that's a good idea. And new drugs. Anything that has come up as an update is always a potential question.
They have Nobel Prize.
Yeah. This time they asked Nobel Prize as well.
Yes, sir. They usually ask Nobel Prize or something which is epidemic, pandemic.
Yeah. Nipah virus.
Yes, Nipah. But that's expected.
Possible risk.
That's expected question. They will ask if there is something happening in country.
But you know what I see is that even though it is all common sense, but there are people, because of the plethora of resources available, they will be looking at all previous things, but they will not focus think like a doctor that suppose you are a doctor making an exam of AIIMS this time. Will you put Nipah virus in the paper? Yeah, definitely you would. When you start thinking like this, you are able to catch all those questions.
Yes, sir.
And please be at a lookout when teachers put up an update. Many teachers have done that update on Nipah, and we recently we've done a update on that antibiotic resistance as well, because these are all hot topics which are being debated world over. So that very important.
They are very important. Teachers know what's happening in their community, so they know what's important.
And that part, if you leave to the teachers, that also saves you a lot of headache. That that updates I will only focus on what teachers are putting.
Actually, now you will keep saying what to do. Sir, updates, new drugs. You are searching Google new drugs in 2018. That's useless.
That's useless. You have to find out what the teachers actually are saying.
Strike rate is very less. You are studying too much and are getting nothing.
Strike rate becomes. Did you utilize the DAMS club also to?
Yes, sir. DAMS club was very important. So usually you are getting encyclopedia of questions. You have some doubts, that search there, you will get there 90% times. You don't have to wait for someone to reply. That everything is there only.
You enjoyed the interaction with the teachers?
Yes, sir.
Were you happy with the teachers interacting and helping you all the time?
So, but I don't need usually. Everything was already there. I just have to search and get okay.
So you were the smarter kind.
Yes, sir. First you put, then you wait. Better you are getting something. It is very good.
And because every query has been discussed multiple
so
times.
Much people are studying, so much are discussing.
If somebody would search, this is a bigger resource than anything else put together. Everything
like encyclopedia, you will get anything, whatever you want.
Any thought on the branch that you want to take?
So I am still considering what will I get, what will I take.
I wish you all the best. I'm sure you should be able to get some good branch that you want to look for.
Thank you, sir.
And any particular teachers that come to your mind that you want to mention in this interview?
Yes, sir. So मेरे सर आप रेडियो पढ़ाई इतनी अच्छी सर, उसके पहले तो फोटो देख के सर क्या सारे तो एक जैसे हैं. फिर दीप्ति मैम and ये Dharma was very good, sir. Jindal sir. First END was ortho. Sir told you won't get too much time, just थोड़ा टाइम निकाल के पढ़ते रहो. Make notes. I make short notes. What will I study in last days? What I have to learn? Remember, टमरना है इसको, फोटो खींच के रख ली लिख के, वो बहुत काम आता है basically.
So you had a planning for the last day as well. So
I have a planning. What will I do last month? What will I do last week? You cannot follow the plan always, but you have to make a plan. What will you do?
And I think it is very important to think in advance that what will you do on the last month, what will you do in the last day. If you don't do this, you will mess up the entire cycle in the end.
You have to focus. What will I do? I was studying, I started reading some books, rare books. Then I realized there is not so much time to read all these things. There is very less time.
Yeah. You have to stick to high yield.
Yes, sir. You have to focus on, sir. Teachers are there filtered. They know what's important. You don't know more than that. They are doing that for many years. They know what's important for you. You cannot run everything. ये book पढ़ लो, इसमें देख लो, उसमें देख लो. You will get caught. You are distracted. ये पढ़ लो, फिर time नहीं बचेगा सब कुछ करने का.
So you focus primarily on notes?
Yes, I focused primarily on notes. I didn't read review books. Actually, I did questions very less. That's why I know I am lagging there. I should have practiced more questions, but notes was my main focus.
With this, I would also now put you in a corner and say, can you say something motivating to future aspirants?
So keep going. Don't stop. Don't worry if you will get selected or not. Just believe in yourself and keep going. Don't stop. If you don't want to study, see some video. Don't want to see video, discuss it with your friends. They know something, you know something. That's very interactive. Let's study in an interactive way. Talk to everyone. Use all resources, but don't go very diverted कि ये भी कर लो, ये भी कर लो.
मतलब सब कुछ करें, ऐसा कुछ मिले कुछ भी ना तो मजा क्या है. So let's have that selectivity in resources is the idea.
As they say, expect the best, plan for the worst, and capitalize on what comes, and be happy. Keep studying.
On that note, I will take this opportunity to congratulate you on your achievement, and I would extend my congratulations to your family members, your parents. I'm sure they would be very proud of you.
Yes, sir. They used to believe me more than I was in doubt. Will I get selected or not? They हो जाएगा तेरा हमेशा तो हो जाता है, तो हमेशा ऐसे ही बोलता है. So they believe me. They give confidence boost. Yes, तो कर लेगा पढ़. That's very important support system. I have some awesome friends, family, my brother and sister.
Heartiest congratulations.
Thank you, sir.
And congratulations to them as well.
Yes, sir.
You want to say something to them through this media?
Yes, sir. DAMS.
You want to say something to your parents, family, through this media?
Thank you so much, sir. I can't say things what I feel. They just feel, they know, I know, but I can't show everyone what I think.
I can understand. So with this, we come to an end to this interview. I wish you all the best for future, and I'm sure you will do well in life. Rise and shine. It was a pleasure talking to you.
Heartiest
congratulations.
Thank you.
Congratulations.